All right, thanks, Brett. Welcome, everyone. Thanks for taking some time to hop on this week's update call with us. We'll go ahead and kind of like we normally do, start with a review of the data and then share some of the information on vaccination, talk a little bit about the release of the Johnson & Johnson vaccine, and then answer any questions that people may have. So, Jordan, I'll turn it over to you.
All right, sounds good. So you should be seeing the MySafe Start County data. Lake County is in risk level A still. Manistee is in risk level B. Crawford, Mason, Mecosta, and Oceana are in risk level C. Kalkaska and Wexford are in D, and Misaki is in E. They've recently had an outbreak situation that caused an increase in cases, so that explains why they're up a little bit. And the daily cases per million and percent positivity are increased for our jurisdiction this week, as are the cases. So we have seen 202 new cases over the past week, and the week before that we saw 151 cases. So that's a 33% increase in cases in the past week. Those cases have been identified from household and community contact, school, including preschool, religious services, care facility resident, pre-surgical and inpatient testing, some recent travel and worksite exposures. Our total number of jurisdiction-wide cases as of yesterday at 3 o'clock was 11,778. Cases by county as of yesterday are Crawford with 561, Kalkaska 568, Lake 343, Manistee 747, Mason 1,143, Mecosta 1,919, with Ferris State reporting 608 cases, Misaki 646, Newaygo 2,703, Oceana 1,797, and Wexford 1,351. And in the past week, we had 2 deaths reported to us and 306 people have recovered. Yesterday, there were 4 positive inpatient cases at Munson Healthcare Cadillac, 3 at Munson Grayling, 0 at Munson Manistee, 0 at Spectrum Health Big Rapids, 1 at Spectrum Health Gerber Memorial, and 0 at Spectrum Health Ludington. And I will share our vaccine table update with you. We did add the age group of 65 and over to the table this week, so you can see how many total vaccines have been given to the 65 and up population in each county according to the state dashboard. So that is by residency. And then you can also see the percentage of vaccine that has been given to the 65 and up population all the way to the right in the table. And that includes both first and second doses. So as of Sunday, February 28th, District 10 has given 36,231 vaccines. 12,573 of those were second doses. And according to the state dashboard, 63,633 vaccines have been given in our counties. So we have administered approximately 57% of vaccines in our counties, but we know that our data is collected a little bit differently than the state. So those are approximations. Are there any questions?
Okay, thanks, Jordan.
You're welcome.
All right. Other news today, or within the past 2 days, obviously the release of the Johnson & Johnson vaccine. So we were notified yesterday that there were going to be about 82,000 doses of Johnson & Johnson vaccine that were going to be coming into the state. We are going to be getting an allocation of that vaccine. The Johnson & Johnson vaccine, again, is a 1-dose vaccine. We are going to get approximately, I think, 1,800 doses or 2,000 doses of Johnson & Johnson that will be adding into our inventory along with the Pfizer and Moderna vaccine that we get. Johnson & Johnson, it's my understanding, did ship out everything that they had currently in stock. And so it is anticipated that initially there will be this large availability of it. And then for the next couple of weeks, as their production continues to ramp up, we're going to see smaller allocations of the Johnson & Johnson vaccine. And then eventually it will get back up there. I know for both the hospitals and the health departments, there was some guidance out there for the hospitals. It was really aimed at using it towards that, I think it's 64 plus population upon discharge. And for local public health was really trying to identify that 65 plus population that may be difficult to get to come in. So it could be like that homebound population or individuals potentially in an AFC home or long-term care type facility. I know in our long-term care facilities that had been matched up with the pharmacy program, the pharmacies had agreed to come in 3 times to provide vaccination, but as new individuals come in or new staff come on board, they would have to get vaccinated. And so potentially, the 1-dose Johnson & Johnson vaccine could be used to vaccinate those new residents or new employees that come on, so that we're not having to make that second trip back. So there's going to be some additional guidance coming out or that we're hoping for to provide a little more direction with the Johnson & Johnson vaccine, but we will be, we will be receiving some of that. We'll be using that as part of our clinics. We had mentioned before that we are looking at doing clinics on Wednesdays, Fridays, and Saturdays. Saturdays, for the most part, will be our second dose clinics, so there'll be a little larger venue. Our Friday clinics, beginning this month, we'll be looking at holding those clinics off-site on Fridays, kind of getting ready for when we do see that additional vaccine in. And so being able to operate in that off-site larger venue type clinic. We do have the National Guard coming in to help with vaccination in our counties. They'll be here on the 12th, the 13th, and the 20th to work in our counties with us. And then potentially we may be requesting additional assistance from them. We have also, we've been very fortunate with a number of community volunteers that have stepped forward to help us with vaccination, both MDs and DOs and RNs and nurse practitioners and LPNs and medical assistants that are within our existing community that have stepped forward and said, they'd be willing to work in these clinics. And then also just general community individuals that were able to fit into more of our support roles. So they can help with traffic flow, they can put packets together at a clinic, they can, monitor parking lots. So it's not, not just all of our staff that are playing these roles, but it's our staff along with our community members, and in some cases, some other hospital type staff that have also stepped up. So it's going to require everybody to move this, to get vaccinations done so that we can move through this. I also know that at 2:00 today, there was a release of an updated epidemic order, actually 2 new epidemic orders. I have not gotten through everything on those orders, so I can't, I don't know all of the specifics. I need to take tonight to kind of read through those and be more well versed in them as of tomorrow. So if you have specific questions on them, you can reach out to me or email them to me, and I'll get you an answer once I get a chance to look through them. But I know one of them focused around visitation at long-term care facilities and allowing visitation across the board, provided there's a negative rapid antigen test. And I believe those facilities have received those rapid antigen tests from the state so that they have those available. So that's a huge plus, so that we can begin to have visitation in those long-term care facilities. The other order was focused more on the gatherings and loosening up some of the restrictions on gatherings. I believe it encompassed increasing restaurant capacity back to 50%, and then also allowing some increased size to indoor gatherings. I believe maybe 25 participants now is the limit. That order will take effect effective Friday and will run through, I believe it is the 19th of April. So it'd be through spring break, and then it will be reevaluated at that time, and determine whatever, what those next steps are going to be. It does appear that in our jurisdiction, and this has happened in a couple other places, but we did have an individual who, was identified as a positive individual after they had completed their vaccination series, but in doing a little more digging into it, it was not the full 2 weeks after their vaccination, and so the time frame is that 2 weeks after vaccination is what it's saying it takes to get that full immunity. And so we did have our first one in our jurisdiction, the first situation that I was aware of where we've had that. So that is something that we are continuing to monitor. Other than that, we still continue to work through our waiting lists to get those individuals into our clinics. Some of our counties, it is getting, we're running into some issues and trying to find individuals to schedule into clinics. A couple of our counties, we still have relatively large waiting lists, so we continue to work through those. We're also now running into individuals who are on who have been on multiple waiting lists and have been vaccinated elsewhere. Walgreens Pharmacy is beginning to vaccinate, it's my understanding. We've known for a while that Rite Aid and Meijer were ramping up their vaccination efforts. So those are other places that individuals can get vaccinated from. Our healthcare systems are also continuing to vaccinate. Some of the FQHCs are also beginning to get vaccine. And so there are beginning to see multiple venues in a community where individuals can get vaccinated from. So as we work through our lists, we are finding that, as we reach out and contact people, they've already been vaccinated elsewhere. And so, trying to get those lists cleaned up so that we can, continue to move through those. We also are piloting an electronic sign-up system where we're piloting this with a few slots, maybe 50 spots in each county, where we're putting a link out there and allowing individuals to go on that link and pretty much opening it up for anybody, and people are registering for it. And so, then we'll have to go back through and make sure that everyone on that link is going to be eligible for the to get the vaccine at this time, and cancel those people that are not. So trying to utilize technology a little bit more in this process. And this is again is something that a lot of the health departments are wrestling with, is how to make this a secure process. And we're no different than that. So we continue to move through that process. We also have begun to work with our food processing facilities and the agricultural farm type sites with the seasonal workers. I know I was on a call this morning, and it appears that the Primary Care Association is really going to push for the FQHCs to work with the growing facilities, so the farms and the seasonal workers, and potentially, we'll deal with the processing type sites. So I know we did jump the gun a little bit on this, as those folks were not becoming eligible until March 1, but I know, we did have communications with Nestle Products down in Fremont, and we did vaccinate a few of their employees last Saturday, as well as Peterson Farms had reached out to us, and so we did vaccinate a small number of their facilities. And we've had a couple conversations with a couple of other places, but so we'll continue to work through that process and get those individuals who are eligible to be vaccinated. Also, had some conversation on a call earlier today about potentially opening up to some of the other groups, priority groups in there. And so, there may be some additional information coming out on that here shortly. That would, again, allow additional people to be eligible for vaccination in all 10 of our counties. Still, we still have our waiting list and those people that have signed up on them. So we still would be working to get those individuals on the lists, but also looking to incorporate in others into the vaccination process to try to work through and move our vaccine. Our vaccine doesn't do us any good sitting in the freezer. We need to get it in arms. And so we need to make sure that we're having people come in and take advantage of those clinics. So I think that's all that I have to share right now. I don't know if there's any questions, or Brett, if you have anything else that you'd like to share, or Jordan, if there's anything else that you'd like to share.
Yeah, I don't have anything else, and I'm not seeing any hands right now.
Okay. Jordan, anything from you?
No, I don't have anything else either.
Okay.
Got a couple hands now. So okay. Wendy, go ahead.
Hi, yes, I had a person who is an employee who had their first dose of the Pfizer vaccine, and they had a reaction to that. Where I know that it was discussed that they should report that to the health department, I believe. Where and who should they report that to?
If they can contact the public health nurse in that county.
Okay.
So, and they will get them taken care of, because there is some paperwork that goes along with it. Obviously, I'm assuming it wasn't a severe reaction.
It was swelling of the face, and
okay. All right.
But
yep.
she typically has some strange reactions sometimes to vaccines, so it didn't surprise her, but she just wanted to report it.
Yep. Just contact the public health nurse in the county that she resides in, and we'll get that submitted.
Okay, thank you so much.
Yep.
All right, Jennifer, go ahead.
Hi, thanks. You had mentioned about the Johnson & Johnson vaccine being included in the allotments that you're receiving for the health department, and that those will be kind of entered into rotation. And I know that some of our staff have been asking about that, because the information that we're seeing is that, because you also mentioned someone who had tested positive after being vaccinated, but the information we're seeing is that Johnson & Johnson vaccine doesn't actually immunize against getting the virus. It just reduces the impact when you have it. And I don't know if that's misinformation that's out there, but we have some staff who are like, I don't want that one because it's not as effective. And I just want to be able to answer some of their concerns in a way that is informed and not just based on misinformation that's being spread. So I'm wondering if you could just talk a little bit about that.
Well, I mean, I can talk a little bit. I'll also run that by our medical director for her, for her take on that too. Yeah, the Johnson & Johnson vaccine has been shown to be effective in reducing the severity of of infection and in preventing hospitalizations. In terms of not preventing getting infected, I'm assuming you're referring to which would be the efficacy of that vaccine, and while it is a little bit lower than what the Pfizer and the Moderna it is still considered to be a very strong vaccine, and will provide some, at least that's my understanding, will provide protection against being infected. But I will double check with Dr. Morris on that, and then have that answer for the group.
That would be helpful. I think the way that some of the news articles are written, it lists it as this percentage of efficacy against mild or moderate symptoms, and this percentage of efficacy against severe symptoms, but lists no efficacy against not actually getting the virus. And that's concerning to people, because they're like, it doesn't seem to be the same as the other one. So I want to be able to answer those questions for them. So I appreciate it.
Yep.
All right, Deborah, go ahead.
Hi, I just wondered if you could give some information on quarantining after exposure. Previously, I know we had, we were still doing the 14 days, and the CDC had the option to reduce that.
Mm-hmm.
What I understand that, we were still being recommended to do the 14 days. I'm just wondering if that's changed at this point.
Yeah, we did adopt, as did MDHHS, did adopt the 10-day isolation, quarantining time frame. And so throughout those 10 days, provided the individual who's been identified as a close contact, provided that individual does not display any signs or symptoms of COVID, then they could be out of quarantine after 10 days. They still would have to monitor their signs and symptoms for an additional 4 days, so that full 14 days. But they could get out of quarantine if they don't develop any signs or symptoms after 10 days.
Right, and I had seen that, but at the time, but it also had said to check with the local health departments, and I believe, right after that came out, you guys were still saying that, yeah, we could do that, but it's better to go ahead and stick with the, stick with the 14 days. So I wasn't sure if that was still in our local area, if it's still being recommended to stick with 14, or if we could move to the, the 7-day 10 thing.
Well, the 7 days would be after testing, and we
Right.
do not support. We do not support, and the 7-day testing was not adopted by MDHHS because of the potential issues with getting testing, and by the time you get it done, it actually ends up being almost the 10 days or 14 days you get your results back. But yeah, we did. We have adopted the 10 days. Ultimately, the 14-day is still considered to be the gold standard for the quarantine period. But we have been utilizing the 10-day quarantine period, provided that person does not have any signs or symptoms.
Thank you.
I guess what I can't guarantee is that we've updated all of our documentation to reflect that at this time. I know they've been working on it, but everything may not be up to date. I'd have to check.
Okay, thank you.
Yep.
All right, anybody on the phone have a question for Kevin? And I don't see any more hands, Kevin.
Okay. Okay. If there's no other questions, I think that's all I have for today. Again, if you have specific questions on the new epidemic orders that are out, let me know. Email those to me or send those to me, and after I have a chance to read through everything, then I'll be better, feel a little more comfortable responding back to those, which, hopefully that'll be tomorrow. Also, I'll check with Dr. Morris on the question regarding the efficacy of the Johnson & Johnson vaccine against getting infected, and have a response that I can share back with the group on that. It looks like there might be one question.
Yep. Gwen, go ahead.
Hi, everybody. I just wanted to mention that Northwest Michigan Health Services responded to a pilot proposal from the state to request 1,000 vaccines for folks age 60 and over within our service area for folks who are residing in areas of high social vulnerability, which Oceana County is pretty much all the census tracts are considered high social vulnerability. So we should hear by next week, and I would be able to announce that we would be able to do a couple of events to vaccinate folks that are in that group of 60 and over. So just kind of stay tuned. But if this group can kind of think about how they could help us spread the word for those types of events, because I don't think those are folks who are already registering in the system for the health department. So we would appreciate that. And I hope to have an update for you in a week on that.
Okay, thanks, Gwen. Any other questions? All right. If not, we'll share Jordan's information out with everybody. And again, if you have questions on the new epidemic orders, let me know. I will try to get you an answer. Probably be tomorrow when I get that to you, and then I'll share the Johnson & Johnson question with the rest of the group when I get the response to that. I guess. I'm gonna ask this question: if as part of these updates, is there other specific information that you guys would like to see included in the updates that we can see about adding in?
Yeah, Kevin, this is Jeff Dons from Manistee, and I guess I would like to see the actual breakdown of, as opposed to what I'm seeing on the state dashboard. And again, might be my simplicity of not being able to navigate it, but I'd sure like to know how many people are vaccinated as opposed to vaccinations given. You know, I just, I'd like to see an accurate number of how many people have been vaccinated.
Okay. Jordan, and we can, you know, we can look at, I don't think. Okay. Yeah. Well, I was thinking the first dose, the number under first dose would be would give that information. But then if the person has received their second dose, yeah, let me talk with Jordan and figure out how we can add that in, Jeff, or see if it's possible for us to add that in.
Yeah, like I get the number off the state dashboard, Kevin, and because that combines everybody and it's done by residency.
Yep.
So again, that as opposed to just whatever District 10, we need to get the full picture.
Yep.
Thank
Okay.
you.
Yep. Let me see what I can do. Anything else that you'd like to see? Is there another? Oh, Gwen, is your hand still up, or do you have another question?
Sorry, forgot to take it down.
Okay. Anything else that you guys like to see added in? All right. If you think of anything else, don't hesitate to reach out. We'll see what we can do. We can always put Jordan to work on more of the data stuff if we need to. And other than that, guys, thanks for taking time to hop on the call with us today. And we'll talk with you next week. Stay safe and have a good weekend, guys.
Thanks.
Thanks for the information.